Welcome back to AM Northwest. As you age, your nutritional needs change, and you can't always get what you need through the food you eat. Here to share ways to supplement your health, we welcome back via Skype the author of Radiant Health, Ageless Beauty, Dr. Christine Horner. Good to have you with us, doctor. How are you doing today?
I'm doing good. I miss seeing you in the studio.
It's a little strange, isn't it? It's a new world. But let's talk about why do you believe that supplements can help us, and how can they help us?
Well, the research really supports that supplements can make a huge difference in our health. So in different decades, we actually find that we have different health issues, and so there's certain nutrients that are more important in certain decades than in others.
And you talk about nutrient matching. What does that mean?
Well, that's kind of matching the nutrients to how old you are, what decade that you're in. So, for instance, in our 20s and our 30s is a time when we're having families. And it turns out that vitamin D3 is extremely important for pregnant women. So there was a study that was done in South Carolina that measured the vitamin D levels in pregnant women and found that 90% of them had insufficient vitamin D levels. And the problem with that is it really increases the risk of all sorts of different complications in pregnancy, like gestational diabetes and particularly preterm birth. So having a preterm birth or a premature infant, as we know, is something that can really be devastating, not only financially, but emotionally. And so what they found is the women that were given vitamin D and they got their levels up to what's considered a therapeutic range, which is 40 to 60 nanograms per milliliter, that it reduced their risk of preterm birth by as much as 60%.
Wow.
So super important to get your levels up to there. And I think, in these days and times with the COVID-19, you really want to minimize the time that you and your baby are in the hospital.
All right, so let's talk then about men in their 30s. What do they need?
So again, vitamin D3 turns out to be very important for men too.
For men too. Okay.
Yeah, and for a healthy pregnancy. So amazingly, it's like vitamin D3 is helpful for increasing sperm count. And they actually found this very odd thing is that if a man has low vitamin D3 levels and his wife gets pregnant, it increases her risk of a miscarriage.
Oh, wow. I had no idea. You mentioned COVID-19, so let's talk just briefly about that. What would you say to anyone, and let's pick any age, what supplements would you suggest for everyone to be taking right now?
Well, vitamin D3 is huge, and that's because it's involved in the immune system. And actually, the former chief of the CDC is out talking about it now, how important it is for us to get our vitamin D levels up, because there's like a direct linear relationship between the levels of vitamin D and your risk of developing influenza and respiratory illnesses. Okay. So that's one way that can really help us to prevent it, but they've also found that it may be helpful in improving mortality rates because vitamin D helps to decrease inflammation, and they find that there's a lot of inflammation with COVID-19, which causes organ damage and increases mortality.
Let's go now to supplements for women in their 40s.
Sure. So when we're in our 40s, it's very common that most people have not been eating the best diets, and we'll start to have symptoms of having too much inflammation in our body. So that can show up as aches and pains, arthritis, and as it turns out, inflammation is actually something that plays a key role in every chronic disease. So from dementia to heart disease and so forth. And so omega-3 fatty acids, these are a type of fat that is considered the healthiest kind of fat that we can consume. Now, we used to think that we shouldn't eat a lot of fat, but it turns out it's very important that we supply our body with the construction materials that our bodies make fat for coating our nerves. Our brains are made out of fat, our hormones are made out of fat, and every cell membrane is made out of fat. So the type of fat that you consume, the most important, omega-3 fatty acids are considered the healthiest, and they have huge anti-inflammatory properties to them too. So again, like vitamin D, there's actually a range that we found that is for optimal health, and you want your blood levels to be greater than, it's called an omega-3 fatty acid index, greater than 8% is what you'd ideally want.
Let's do women in their 50s.
So as we get older, we find that our systems in our body don't function as well. And this includes the immune system. And again, super important, right now. And this is why as older people will be more prone to getting infections, and they can have a higher risk of mortality associated with it. So there's things that we can do to actually keep our immune system really strong. And a very simple thing is to take a supplement that's made from mushrooms. So mushrooms actually are the food group that help to support our immune system the most. And so the supplement that I recommend, I'm just most impressed with the research, is something called AHCC. And AHCC is a mushroom extract out of Japan. It's been around for about 40 years, and they found that it's the most effective formula in helping to support all the different cell types in our immune system. So it, can lower our risk of infections. It also has been shown to even decrease our risk of certain cancers. And at this point in time, I actually doubled the amount of HCC that I'm taking to make my immune system as strong as it can be.
Dr. Horner, we've run out of time, but we want to suggest to everyone to check out Radiant Health. Ageless Beauty is the name of the book, with all the information there for all the age ranges. Thank you so much, Doctor. I appreciate it.
You're so welcome, Helen. Stay safe.
You too. We'll be right back with more AM Northwest. Don't go.